Hello, welcome to NYC Health and Hospital, Kings County, YouTube podcast. I'm Dr. Renuka Ananthamoorthy, Chief of Behavioral Health Services, and I'm the host today on this series of behavioral health podcasts. Today's episode, we are delving into the complexity of substance use and mental health. We will explore the nature of addiction, its impact on mental health, and the treatment options available for opioid addiction. We are joined by Dr. Jennifer Mark, Director of Substance Use Services, and Dr. Shaina Singh, Addiction Psychiatrist. Dr. Mark, can you define addiction for us?
Sure. People with addiction use substances compulsively, find it very difficult to stop, and often continue despite harmful consequences.
And what do you think it distinguishes from habitual use, and why is it considered as a chronic disease?
With habitual or casual use of substances, there may be a sense of being more in control and of being able to stop or slow down without too much difficulty. Also, the substance use isn't typically causing problems with other aspects of a person's life, like work or family obligations. Addiction is considered a chronic disease because even with treatment and periods of sobriety, there can be relapse. From a biologic perspective, there are changes that take place in the brain with addiction that can be hard to completely reverse. And in that way, addiction is like any other chronic disease, like diabetes, for example. But that doesn't mean that there's no hope. Many people who struggle with addiction at one point in their lives can go on to have long periods of time with no use. A combination of medications for some addictions, with counseling, support groups, and psychotherapy to get at the roots of what might have caused the addiction in the first place, gives a person the best chance at sustained recovery.
So you're saying that people who are using habitual use can become as a chronic disease if they don't take action earlier on or get help.
Yes, it's definitely a spectrum. So casual use of substances usually causes no harm in a person's life, whereas if the use continues, becomes compulsive, it may develop into a true addiction. At that point, and maybe even earlier, help is needed so that it doesn't start causing problems with other aspects of a person's life, like work and family obligations.
Dr. Singh, how does substance abuse affect mental health?
So the relationship between substance use and mental health is bidirectional. There are a lot of risk factors that account for both: demographic factors, trauma or adverse events, genetics and socioeconomic status, amongst others. In 2023, the National Survey on Drug Use and Health found that 1 in 3 adults have either a mental illness or a substance use disorder. 2020, it was estimated that 6.7% of adults had co-occurring mental illness and substance use disorder. Mental illness can cause distressing symptoms and put people at risk for substance use. Compared to the general population, people with mental illness diagnoses like PTSD, antisocial personality disorder, mood disorder, and schizophrenia have higher rates of substance use and substance use disorders. We have a good understanding that all substances have an effect on people and brains as well. So depending on the substance, they can act on various receptors in the body and brain to affect acute physical, mental, and emotional changes specific to that specific drug. Changes can happen acutely, so in intoxication or withdrawal phases. For example, when we see patients intoxicated with stimulants like cocaine or methamphetamine, they might have psychotic or manic symptoms. Many times those symptoms resolve with time and as the substance is metabolized. In other cases, repeated substance use can create changes in the brain that are more pervasive. This leads to physical dependence and changes in the reward pathway, leading to addiction. Chronic changes can also precipitate a lasting mental illness or psychiatric symptoms. A great example here is with cannabis, where robust research shows that cannabis is a known and significant risk factor for schizophrenia. What we've come to understand is that screening and treating for both provides the best access and outcomes.
So there is a lot of increase in rate and coincidence of substance abuse and mental health. As you explained, Dr. Singh, it is really a high rate you're talking about and how to deal with it is what we are going to ask Dr. Mark now, how to take care of addiction and the treatment choices available. And Dr. Mark, and again, with what Dr. Singh said and what you're going to talk about, the available treatment option. So tell me what is available at Kings County and what is available outside in the community. And if you can talk more about the options and how they can access the care, what they need.
Sure. Medications can be very useful to treat certain substance use disorders like alcohol use disorder and opioid use disorder. And getting a handle on these addictions makes treatment for any co-occurring psychiatric illness much easier. For opioid use disorder, we have two main medications. One is methadone and the other is buprenorphine or Suboxone. Both these medications work well to prevent opioid withdrawal and suppress cravings, allowing a person to get on with their lives and put opioid use behind them. It is considered the standard of care to be on one of these medications when being treated for opioid use disorder. For alcohol use disorder, we also have medications that can help with alcohol cravings while a person is being treated with counseling, support groups, and/or psychotherapy.
Can you also discuss the differences between addiction to prescribed meds and addiction to over-the-counter or street drugs? How do you differentiate between those two?
Addiction to street opioids like heroin and fentanyl and to prescribed opioid pain pills like oxycodone is essentially the same disease and is treated similarly. It's important to know, though, that sometimes oxycodone or Vicodin on the street can actually be fentanyl manufactured to look like one of these prescribed pain meds. In any case, medications to treat opioid use disorder, either methadone or buprenorphine, would be the recommended treatment. And both these modalities are available at Kings County Hospital.
Thank you, Dr. Mark and Dr. Singh, really talking about these challenges, what we have in the community regarding opioid crisis and other substance abuse, what's happening in the country. And what is available at Kings is more important for a community to come in and get the care what they need. Thank you so much. And thank you everyone for tuning in.